Hi, thank you all for joining us today to talk about digital engagement to improve total joint replacement cost and care and lower cost. I'm Deb Zalvin. I'm the Executive Vice President here at UbiCare, and I'm joined today with Dr. Todd Smith and Bill Lindsay. Dr. Smith is a family physician and former CMIO at Health East. At Health East, Dr. Smith has led change around the system's EHR, including improving provider documentation and its efficiency, increasing patient safety and overall quality. Dr. Smith has used technology to help staff do their jobs better and connect with patients in new and exciting ways. He received his medical degree at Mayo Medical School. And Bill Lindsay joined UbiCare in 2010 as Executive Vice President of Content, UI, and Product. Prior to that, he spent more than 2 decades leading editorial operations for targeted multi-platform, multi-platform media ventures. He has a depth of experience creating high-quality, engaging content in a variety of subject areas, including health, education, parenting, and life stage issues. Bill is a former fellow of American Press Institute and the Casey Journalism Center for Children and Families at the University of Maryland. And now I'm going to turn it over to the two of them to lead you through this webinar.
Okay, thank you, Deborah. So we're here to talk today about a particular, we think, interesting case study that has been underway with folks at Health East for the past 18 months or so. And it's important that to say right at the outset that Dr. Smith has been integral to this project, not only getting started, but its continuance and the fruition that we're now seeing it come to in terms of what the data is showing on not only patient engagement, but the outcomes associated with those patients. A little bit about UbiCare real quickly. Many of you may be familiar with us, but some of you may not. So we have been around for about 14 years providing patient education and patient engagement through targeted care continuum or care episode solutions on behalf of hospitals. We've worked with Health East for a number of years prior to this project. So a little bit more about us.
There's two of our pictures there for you. So yes, I was the CMIO at Health East. We've combined with Fairview Health Services. I'm also a family physician still practicing. And we'll talk a little bit about Health East. We are a 4-hospital system. We have 3 acute care hospitals, short-term acute care hospitals, and 1 long-term acute care rehabilitation hospital. We're in St. Paul, Minnesota. And there's some of our statistics for you there. We are on Epic for our electronic health record, and we are pretty aggressive with our MyChart portal as well. And as mentioned there, we merged with another group in town, Fairview Health Services, last June. So we've started with UbiCare at Health East 10 or maybe a little bit more than 10 years ago with our OB population. It's been wildly successful, wildly popular with this group of patients. And they get a lot of information in the prenatal period compressed to when they're signed up for it, and they can get it in text or email. We also have an integration with the MyChart portal as well for the OB population, but we had a lot of success with them using it for that, and that's, again, wildly popular, and lots of really great comments that we get from patients about that carries on after the delivery as well.
And that's reflected in the patient satisfaction surveying that we do 90 days after they've had their child. 91% report taking better care of themselves as a result of the messaging they've received. 97% report being more confident to manage their own care, and 77% report a stronger connection to their hospital because of these ongoing messages.
And that's been consistent for years. It's really been great.
So the UbiCare solution employed by Health East and others, again, starting with the OB population, but now being applied also with the orthopedic population, specifically those having total joint replacement surgeries, really is a two-pronged approach. For the patients, they received sequence evidence-based patient education via mobile optimized email and text, all branded to Health East in this case. And that takes them throughout their care episode, starting before they've had their surgery and then continuing 6 months after their surgery. And the solution also offers for providers not only a dashboard with data analytics around the patient population's engagement with those messages, and also their responses to both embedded and standalone surveying questions, but also the provider has the frequently asked questions that they often receive from patients are superseded by many of those questions being answered in a timely way in the messages before the patient necessarily even asks them. This frees up time for providers to focus on more meaningful and individualized conversations when they do have the appointments with the patient. Next slide. So as alluded to before, the UbiCare solution, an integral part of the UbiCare solution is its following the patient and guiding them throughout the entire care episode. In the surgery, total joint replacement surgery case, we have 6 core pre-op messages as well as some additional messages that are oriented toward the pre-op phase, and those are delivered regardless of the extent of the pre-care period. So, for example, some people may not have their surgery scheduled until 2 weeks before they're going to have the surgery, and some may be scheduled 2 months. And our system ensures that they get all the pre-care, preoperative messages that they need to get, whatever that time frame may be. And then on the post-care side, we follow them for the 6 months post-op. Now, this slide represents the enhanced connection that these kinds of ongoing sustained messaging provides between the patient and the provider. So while there may only be a handful of actual in-person appointments, this establishes and sustains that relationship, that connection between the patient and provider, reinforcing the things that the provider is telling the patient about what they need to know to be prepared, what to expect of the episode, the care event itself, as well as during the recovery and rehabilitation period. And it's important to note also that the solution allows for two-way communication. So it's not just the providers pushing out the information they want their patients to have, but also providing a conduit for patients to ask questions back in a secure way directly to their provider, as well as give other feedback, not just the data feedback of how they're interacting with the messages, but also the data points around how they're answering questions and that sort of thing.
I would reiterate at this point that we hear sometimes some concern about, well, it's going to lead to a lot more messages that I'm going to get, but as Bill alluded to earlier, the content actually preempts a lot of those questions. So the messaging that can happen is often, I would call it high quality, meaning, they're specific questions to that patient or something rather than just general questions about pre-op or post-op care.
Yeah, and it's all customizable too. So if there are particular issues, a particular hospital or clinic has found that they really need to emphasize with their patient population, they can change or revise or add that content to address that in the way that they wish. So this is kind of where this whole project all started. In 2014, UbiCare did a outcome study with another hospital called Parkview Medical Center in Pueblo, Colorado. And at that time, they were particularly interested in looking at a few key points of outcomes, particularly reducing length of stay. So we did that research and publicized that, wrote some case studies on that and shared those. And that was really what was the introduction of this for Dr. Smith.
Right. And so I talked with folks here about this study, and was presented with this data, and I said, oh, that's really interesting. I would love to try to replicate this at our organization, and I think we can even do better than this on some other outcomes, then look at more things and influence more parts of the patient experience. So that's what led to us starting. And so when we look at this, these are kind of the areas we are hoping to impact with what UbiCare can provide. And I think all of you could probably look at this list of 6 things and agree with all or most of them. This is things that you are also looking at. Length of stay, hospital readmissions are kind of old standard metrics that we use around outcomes of hospital interventions. But we also looked at some other things, including day of surgery cancellation, which became very obvious that that's a potential for really adding potential revenue / additional patients, making surgeons happy by actually operating on people rather than not operating on people. Also looking at discharge destination. Where are we sending these people to? Are we sending them home? Are we sending them to a skilled nursing facility? And then return to ED. And the bottom right one, their patient satisfaction and reputation, is also something we were looking at. These, I'm sure, ring a bell with all of you. This again is back to that episode of care, looking at, rather than just doing something at the point of care, which is the shortest amount of time, which traditionally is where we've tried to impact these patients. Let's look at connecting with them in a pre-operative or pre-care way. And that's when we can impact day of surgery cancellations as well as discharge destination, because we can prepare these patients for what's going to happen to them much better if we start that process in the pre-operative or pre-care venue. In the post-care, you're looking at impacting readmission rates and ED readmissions.
So it's important to say at this point, as we delve more specifically into the data in the study so far, this is an ongoing study, so this is still somewhat preliminary data, but we're now looking at a fairly substantial data set. As you can see, 539 cases have been participating in this intervention since mid-July last year, and this is through the end, basically the end of the first quarter of this year. We've been comparing this data both to the 2016 entire year data at Health East, as well as the Q1 data for 2017, which is, at this point in the process, is a good comparable group because it's pretty similar in size. So a couple notable things about this. Of this current population receiving the intervention of 539 people, 107 of those patients are still in the preoperative phase, so they're getting those preparatory messages, the ones that help set their expectations and prepare them for their surgery and a good outcome afterward. And then 432 patients have now proceeded into the post-op recovery and rehabilitation phase. It's been really exciting to see that in this patient population, we've sort of divided them up into 3 groups in terms of their level of engagement. And 66% of the patients are showing high engagement levels, and we've defined that as opening over 50% of the messages. And this is useful information also because it helps patient navigators or clinical staff hone in on those folks who are not engaged and therefore potentially need outreach in some other ways. We know from experience that not being engaged is certainly one indicator that people may be at risk for going off track. So
I would say these numbers are quite high for engagement from what we have seen with other similar interventions. Not sure if it's because in Minnesota we tend to do everything better, or if it's just the quality of the program. I'm kidding, of course. I think we know why it is. It's a very good program, and people are opening it and engaging, which is different than just patient education, where people look at something and then ignore it. These people are actually looking at it, engaging in it, opening multiple messages, and then changing behavior, which is the exciting part.
And we purposely set the bar pretty high about how we were defining these levels of engagement. In typical healthcare messaging, open rates usually hover around the 22 or 23% range. So delineating the highly engaged group as 50% or more was a purposeful effort to really say, we want to define the highly engaged people as those who are really interacting with most of the messages. And then, well, we can go on to the next slide.
Okay. So looking at day of surgery cancellation, you can see when we compared to the first quarter of 2017, we had about a 4% rate of day of surgery cancellations. We'll look at reasons for that in a minute, but we were able so far, again, preliminary data, to really look like we have a significant decrease in that day of surgery cancellation, getting it under 2%. When we look at reasons, causes specifically, we'll see in the next slide, but just generally, we feel about 2/3 of them are preventable causes. 10% are out of the control of really being preventable, but we'll look at that here. The next slide. You want to talk about this, Bill?
And I think it's important to say about all of these next few slides and data points we're looking at, there's a lot of factors at play here, so we're not necessarily asserting that this particular intervention in and of itself all alone led to these kind of outcomes, but there is clear evidence that in concert with other efforts being done on the clinical level and whatnot, that they are impacting patient behaviors and patient outcomes. So, so this slide delves a little bit more specifically into that preventable, that 64% preventable reasons for day of surgery cancellation. So those are the ones listed in, I guess it's pink here. And we know that a number of those are pretty easily addressable through our messaging solution. And we, after surfacing this data, went in and made some adjustments, amplified the guidance given around some of these issues, including adding additional messages to build in some more planned redundancy to really reinforce the importance of these issues. And that plays into adult learning theory that says we have to learn things 7 or more times, or hear things 7 or more times before it really sinks in with us. So we included messages that said things like, some people are surprised to show up for their surgery and be told they can't have it because they inadvertently or unknowingly, or maybe even neglectfully, didn't stop all food and drink intake in the 12 hours before their surgery, or they didn't stop their blood thinners before surgery, or they didn't use their antiseptic soap for the 3 days before surgery. Some of these kinds of things that really are ultimately preventable if your patients are aware and adherent to the guidance that they're giving on those kinds of things.
So looking at length of stay, we've had data for 383 intervention cases so far, looking at length of stay decreasing to 2.3 days from 2.46 days in the first quarter of 2017. It's not much. We started at a pretty low length of stay, honestly, because there had been a lot of work done in our hospital system in the years leading up to this around length of stay decrease. So, but even with that, recouping a fifth of a day, if you will, per patient. And if we look at some possible revenue potential around that, just decreasing it by that much could, now understanding this is in a perfect world with endless patients and endless ORs, but decreasing that length of stay, moving patients through our hospital system could add as many as 130 new joint replacement cases through the year. And using numbers that are familiar to the industry gets us almost to a revenue potential. Again, a potential, not that we're making this much more money every year, but a potential of almost $2 million.
Yeah, and I think even if it was half that or a third of that, that's not insignificant savings potential or new revenue potential there. As well as, I guess the point is that there's value in the expanded capacity that the intervention seems to be enabling,
right,
along with other efforts.
This is a big one. We were surprised actually by this, or I was, among, again, that intervention cases so far, post-discharge. Discharges to a SNF or a skilled nursing facility decreased by almost half. So to 10.1% from 18% last quarter. Again, looking at a lot of surgeries per year and the potential for that many more patients going home and saving almost $1 million to healthcare in general. That's not specifically to Health East, obviously, but just dollars that are being routed different places. People going home instead of being sent to a TCU. Again, recognizing there's a lot of work done around this, and it's not just this intervention, but we think that a lot of it is because we do talk a lot about what to do before the surgery to these people to make them realize you don't have to go to a TCU afterwards. You may be able to go home, and you should have that conversation with your doctor about that. Looking at ED visits and readmissions, both small, but I feel real decreases in both of those from last year. And again, potential savings if we do reduce readmissions. Again, we're starting readmissions at a pretty low rate, even in 2017, but a so far statistically significant decrease in both of these numbers.
And what's interesting to note also here is the sort of next iteration of our looking at this data, we've begun sort of slicing and dicing the intervention group population by patient characteristics. So we can take into account things like age of the patient, gender, which joint they were having operated on, were they a private payer, Medicare or Medicaid, even down to a zip code level. And from our early findings relative to doing that kind of sorting and slicing shows that these three areas that we've seen the most significant improvements in being the day of surgery cancellations, the discharge to home, and the reduction in ED visits has stayed consistent across all those different sorts of by patient details. So one of the areas, so most of these areas that we've been looking at so far really are going to be of primary importance to either the clinical side of the hospital or and/or the business administration side. We know that, well, everybody wants satisfied patients, but particularly the marketing and business folks want satisfied patients. So one of the things that we do 90 days post-op, and the reason we do it 90 days is to not interfere with other patient satisfaction evaluation measures that might be in place, Press-Ganey and those kinds of things. We do a satisfaction survey specifically around patients' feelings about their experience with this intervention, with these messages from the hospital. And as you can see, almost half of the group, the intervention group, has now reached that 90 days post-op points. 25% of them have responded to the survey, and by survey response standards, that's very high. So we're pleased to see that. And I think it speaks to the value they've seen and the benefit they've felt from this intervention. And that's reflected in those statistics you see there about being more confident about their care, managing their care, feeling better prepared for their appointments, which also leads to confidence, which we know is important to outcomes too, and feeling a stronger connection to the hospital. The fourth key data point of this sort that didn't make the cut on the slide but is also significant is 82% reporting that they're, because of the messaging, they're more likely to recommend the hospital to a family member or a friend. And then we also have freestanding comments that they add as well on these surveys, and these are just two examples of some of the good feedback that the intervention has elicited.
So that's the end of our presentation. Again, some pretty exciting stuff. It's preliminary data, but we're pretty pleased with it so far, and we look forward to doing some more slicing and dicing, as Bill said, about the data, yeah, and carrying this program on, because it has been very well received by a lot of patients, and the providers are enjoying the outcomes of it too.
So we invite you to post your questions in the comments area, and we can take a few minutes to respond to those. I know this webinar was scheduled for an hour. We had planned on it being more like 30 minutes, so we do have a few more minutes that we can answer some questions or respond to comments if any of you have any.
Or we answered all the questions already.
So while we wait for people to ask any questions, I have a question for you, Dr. Smith. So with this intervention is really based around having a digital connection with patients. How do you feel that patients like see a difference, feel a difference between the direct care that they're receiving in the hospital versus how you're really supplementing it outside of the hospital?
Yeah, I think they see it as a supplement. I see them, in welcoming it as coming from Health East. I mean, it's not like it is something that they don't recognize, right? So they see it coming from us, someone they trust, someone they know, and it's really supplementing their care, not taking the place of anything. So I think that's a huge motivator for why this works so well, and a huge benefit to patients and to the organization.
I'll share another comment that was part of that satisfaction feedback that we talked about on that last slide. One patient 90 days post-op reported, "These messages were not used in my first hip replacement, also at Health East, even though I knew exactly what to expect during my second replacement this time around. The messages were very reassuring and I felt much more connected to the helpful resources. Thanks for putting this process in place."
Great. And so we have a question coming in asking about if you've interfaced this with your EMR and or portal.
Great question.
Great question.
Which we should have addressed in
Right.
more detail up front. I'll try to keep this as concise as possible because it's a long story.
A long story.
So we have a connection to the MyChart patient portal on the OB solution that we talked about at the very beginning, and that was our intent to do with this joint project as well. What we found in trying to work with the IT department that's been very supportive through this is it was a challenge to get adequate bandwidth time to set up that bidirectional data feed to the patient portal that would also feed the patient information needed to enroll them to get the messaging. So we ultimately went for a quicker, shorter, easier solution, which was automated both enrollment and now outcome data being extracted from the EMR, basically through a simple extract report. And then that is posted for our system to absorb and work with to ensure the patients are getting the right messages at the right time, and then also get the outcome data, which on the back end that we can use to put together the facts and data that we've just been talking about. Thank you for asking that question, because we would have been remiss not to mention that a little bit.
In a perfect world would have been great, but just the time factor and the bandwidth and what we were trying to accomplish, we felt that this was a good solution.
And it's still the longer term intent to fully realize those connections as well.
So following up on that, someone is asking, based on the results that you're seeing here, would you plan to make the effort to interface?
Yeah, I think so, yes. Yep.
Any other questions? If not, oh, yes, perhaps there is one other question coming through. Someone else is asking if you use the text feature of the YubiCare solution.
Yes.
Yes.
To a smaller extent, because we just started it a while ago, a few months ago. But yes, that's certainly a direction we want to make that option available for people to get it both via text and email.
Yeah, and interestingly enough, we're seeing pretty much the same levels of engagement on the text side. There's a little bit different rules, regulations around opt-out versus opt-in. The email solution is really being done as an opt-out, which means patients, once they have a surgery date, are automatically signed up for this intervention, and it's communicated to them what it is and why, that it's really considered an important part of their care. Health East has made it a standard of care for total joint replacement. So essentially they can be, once they have that surgery date, they can just start receiving the messaging series. On the different regulations on the text side require that they receive a text opt-in invitation. So we do have that in place. We've seen a little bit of difference because of that in terms of the percentage of potential text recipients who are choosing to get the series, but those that do choose to get it do engage at pretty much the exact same level that the email recipients are engaging. So I think that's one of the things that we're going to continue to work on and look at, is figure out ways to make that initial invite more compelling to them. And a part of that might be the communication that's had with them in the surgeon's office, you know, from the very get-go.
So somebody's asking, do you feel that would better, I think the text would better engage the generational communication preferences?
I would say yes.
And a couple other questions have come in as well. So about your connection through MyChart, is your connection with the patient only through the MyChart?
No.
No.
So the way it's both, really. So we provide timely, relevant information for the pregnant moms through their MyChart, but then also the MyChart portal, that the pregnancy portion of their MyChart portal not only gives them information right there, but also connects them to deeper detail on information for that point in their pregnancy, as well as their interaction with that deeper detail automatically enrolls them to begin receiving the push messaging via email or text.
And can others receive this besides the patients?
Yes. So we encourage on both, all service lines really, certainly pregnancy as well as joint replacement. We encourage patients and their families to enroll as many people as they want. So it can be very beneficial, clearly, on the pregnancy side to have you know, the spouse or partner receiving the same messages that the mom-to-be is, and likewise on the joint replacement, you know, spouse, partners, other caregivers and family members, children can can really help support the understanding and preparedness of the patient by having the same information that the patient's being given. And we hear about it, you know, somebody say, oh, Mom, did you see that particular thing about preparing your house for when you come home after surgery so that it's safe for you? Right. That kind of thing.
Yep.
So one last question, and I believe you covered this already, but someone's asking about it, so we'll just touch on it one more time. They're wondering how in advance, how you are sure that all your patients are prepared in advance. So for example, if a patient signs up, but their surgery isn't for three more months, when does the first communication start?
Right. So we do have a sort of outer framework set so that in the rare occasion that somebody might be signed up 6 months in advance, it doesn't work out that they're getting the 6 or 8 pre-op messages every 4 weeks or 3 weeks, because that would sort of dilute it too much. So within, I believe it's 2 months out, that window of time will, the schedule adjusts to make sure that they get all of the pre-op messages in that window of time, from 2 weeks down to, I believe, about 8 days. Less than that, there's not enough days for the messages.
So the same information is given to all the patients. It's just compressed to the time that is required. And
we find with the Health East population, we found that on average it's been a few days over 3 weeks is in advance is when they're getting enrolled to receive the messages. And a lot of our ortho clients tie it to participation in a joint class or a joint camp, as Health East frames it. And that's important too, because depending on how far in advance that those classes or camps are scheduled, it's a reinforcement of the things that not only has their surgeon been saying in the pre-op appointments, but also that they've been told in the classes.
Great. Well, with that, I want to thank both of you for taking us through this study. Thank you, Dr. Smith. Thank you, Bill.
Thank you.
And
Thank you all for logging in.
Exactly.
And good questions. Thank you.
Yeah.
Yes, thank you all. And please be in touch with us if you have any further questions. We are here. You have our contact information at the bottom of this slide. Thanks. Bye-bye.